Hi, this is Dr. David Green, CEO of the Mid-Atlantic Pain Network. Today's topic is the basics of disc bulges and disc herniations. Now, looking at the normal intervertebral disc, it's about 80% water and then 20% proteins and other collagens. So typically, it's a great shock absorber as we walk, twist, bend. It absorbs the shock as the water gets pushed out and then it gets pulled back in. There are two areas of the disc. The outer layer is called the annulus fibrosus. It's a little bit harder than the inner layer, so a lot of people refer to it as kind of like a jelly donut with a harder outer layer. There are nerve endings here, so it can feel pain. The inner jelly layer is the nucleus pulposus. You can't feel pain here. There's no nerve endings at all. Now, talking about disc degeneration, between the ages of 20s and the 50s is when it's most common. It's most common due to a number of factors. First one is obesity. Smoking can degenerate. Repetitive trauma, such as being a truck driver for 30 years. Genetics, and then social and environmental factors. So if you look at a healthy disc here, and then it starts to degenerate and you lose height and it starts to bulge, almost like a tire that's getting flat. And then here you really have minimal disc left. It's starting to basically fuse. All right. Now, when you disc degenerate, you start to lose water in your disc. That 80% starts to go away. You lose disc height as a result, and then you can get these tiny tears or cracks in the outer layer, the annulus, and it can start to become painful. Now, a disc bulge is the losing of water in the disc, and it's almost like a tire losing air. You start to lose height, and you start to bulge out with the disc like that tire that's getting flat. Okay. Now, 35% of those between the ages of 20 and 40 have this kind of looking MRI and no back pain at all. So just because you have this doesn't mean it's going to be painful. Okay. If a tear occurs in the annulus, it may cause considerable back pain. All right, because there are nerve endings in the annulus. If the tear is large enough, a disc material from the inside can squeeze out. So you see you have a disc bulge here, but then you actually have a tear and the disc material starts to push out. Okay. There's different terms for this: slip disc, herniated nucleus pulposus, herniated intervertebral disc. They all mean the same thing. Symptoms of a disc bulge and herniation. Most disc bulges, no pain at all. Okay. Bulge symptoms may include back pain, sciatica pain due to annular inflammation, possibly spasms and aching. A disc herniation, if it's pushing on a nerve root and causing inflammation, that can lead to sciatica, which can include burning, searing pain, pins and needles or numbness, motor weakness, and rarely incontinence. So what are the treatments of a disc bulge and herniation? If it's not hurting that bad, benign neglect is not the worst way to go. Over-the-counter medications such as anti-inflammatories and Tylenol is where we should start with this. Physical therapy and chiropractic treatment can help a lot. Spinal decompression therapy is an intermittent spinal traction. Prescription medications may include a short Medrol dose pack. That's a few days worth of steroids that tapers off. Narcotics and non-narcotics. Narcotics are fine for short-term use, but not for long-term. Muscle relaxers when short-term exacerbations exist. Neuropathic medications can be really good for sciatica-type symptoms with Neurontin or Lyrica. And then topical prescription pain creams or patches. Interventional treatments may include trigger point injections, which are great for spasms and aching. Intradiscal injections, that can be either steroid medication, or the newest is to inject stem cell therapy, which has been shown to be very helpful for repairing and regenerating the disc, along with obviously providing pain relief. And then epidural injections. If you have sciatica and a nerve root's getting pinched, you can get an injection of numbing medicine right around the area of where the pinching is occurring, and that can provide a soothing relief with the steroid. Over 75% of individuals with degenerative disc disease and symptoms are able to avoid the need for surgery. Out of those with sciatica symptoms, over 95% are able to avoid the need for surgery. Okay? There was a landmark study years ago which looked at disc herniation versus surgery versus not surgery. They showed that the outcome is no different. The Mid-Atlantic Pain Network offers the top non-operative pain management in the Maryland, Virginia area and surrounding areas. There are many clinics throughout the region in the network, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Green with the Mid-Atlantic Pain Network. Your pain stops here.